Good day to all our viewers that's been following my educational talks regarding common ear, nose and throat problems, and to all the new viewers. Hopefully we can supply you with some information regarding common ENT problems that can assist you in maintaining good health. So today we would like to discuss a problem that is called sleep apnea, which is very often and commonly related to severe snoring. So when a patient snores at night when they sleep, there often can be a condition related to snoring which is called sleep apnea. Now, this is a condition that's sort of under the radar quite a lot, in the sense that people always just think, the person's just snoring, there's no negative effects regarding it and so on. But snoring by itself is quite a disturbing social problem. As many spouses can vouch that if somebody snores loudly next to you, then there is often quite a problem by sleeping properly yourself. So apart from the patient not doing well as far as snoring and possible connected sleep apnea, like I'll describe in a minute, the partner also don't sleep well because of the noise. So that is something that often can relate to or lead to quite a lot of social problems within a family. Sleep apnea, which is often related and can be related to severe snoring, is the condition where the patient snores and then at one point stop breathing. They stop breathing for a while and just lie like that and don't breathe. And then after a while they'll start breathing again, start snoring again. That is called sleep apnea. Now that's quite a dangerous condition to have, because what happens if you don't breathe is that the oxygen level in your blood drops, where it should not drop below 90%. These levels can drop down to 60%, even less than that, which causes a lot of stress on the body. So the impact of the sleep apnea is, while the patient should be resting, recovering, recuperating, this does not happen because the body is stressed all through the night, because often these sleep apnea episodes happen throughout the night, and therefore the patient the next day is very tired, fatigued. We call it daytime fatigue, because of the body being stressed at night instead of recovering. So this leads to chronic fatigue, as can be one of the reasons for general fatigue. The other problem is that if the oxygen levels drop to that low, as we mentioned, the whole body is under stress, but specifically the heart and the brain needs very high oxygen levels to operate properly. So if these levels drop low, as we mentioned, even sometimes as low as 60% or lower, then there's a risk for a heart attack or a stroke during sleep, which is something that we want to avoid, obviously, as far as possible. So snoring and sleep apnea has a very direct negative impact, as we mentioned, on social life, but also on the patient's specific health. So what we do when we evaluate these patients is the GPs usually should and hopefully ask if there is problems with severe snoring and describing sleep apnea, and the patient himself will not know any of this because they are asleep. So it's usually the partner or people in the house that will say, listen, you are snoring quite a lot, or secondly, you stop breathing at night. We really have to take you to a doctor to help with these conditions. So often the GP will then refer the patient to us, or the patients can come directly to us. And then when I see the patient, we will take the history and find out what the situation is. There will be an examination within the office then. Usually apart from the normal ear, nose and throat examination, we also do a fiber optic examination where we look into the nose and the airway with a small little telescope. This just happens in the office, and that supplies us with quite a lot of initial information regarding the possibility of snoring or the causes of snoring and sleep apnea. Most of the time the patients will be referred then for a scan of the nose and sinus areas to get some information regarding the anatomy and the airflow. Secondly, we usually do some allergy tests, see if there's not allergy involved as one of the contributing factors that lead to swelling of the airway, and also can lead to these problems. And then very important, we do what we call a sleep study. That's where the patient just sleeps at home with a mobile sleep study apparatus, a computer that is attached to the body, and that monitors for me what happens during the night as far as snoring and breathing is concerned. What type of snoring, these apnea episodes as we call them, do they happen if they happen, how often does it happen, how long is the duration of those, the time where the patient don't breathe, and then very importantly, what happens with the oxygen levels, how low do they actually drop. So following this, the patient comes back to see me, and we in detail discuss the results of these tests, and then I compile a management plan which how to address the snoring, and if apnea is also present, to address the apnea problem. So after doing this, we will then go ahead with treatment. Now treatment, just in general and as a quick summary, consists of either improving the airway and the flow of the air, if there are problems on the examination and the test we did regarding this. So sometimes we will do some corrective surgery of the nasal septum to improve airflow, to wash out the sinuses, to help with the better functioning of the sinuses. Sometimes if there's large tonsils involved, we will remove the tonsils as well to improve the flow of air during the night, which can contribute a lot to managing these problems. This is then usually the initial management. If in certain cases that is not indicated, the improvement of the airway, we will then look at the possibility of CPAP treatment. CPAP is an abbreviation for constant positive airway pressure. So this little machine that is next to your bed at night, and with a little tube, there's a little mask that fits over the nose, which will then deliver positive airway pressure to the air pipe to prevent the vibration of the airway, and therefore the snoring can be limited. And secondly, it prevents the collapse of the airway, which causes that sleep apnea episode, by delivering positive airway pressure. So that's sometimes that we will go that route in management. Or sometimes there's a combination of corrective measures to improve the airway surgically and the CPAP treatment. So I hope this gives a quick summary of the problem of snoring and sleep apnea. As we mentioned, that become very detrimental to the patient's social environment, but also his health, and how we look at that, how we examine the problem, and then eventually how we treat the patient to hopefully create a happy patient and a happy family and a happy life.